Hello everyone, once again welcome to my YouTube channel. I hope you liked my previous video of introduction part of general anatomy. So today we'll start the next chapter of general anatomy, that is your skeleton. So let's start without wasting the time. So if we talk about skeleton, it includes mainly two things, that is your bones and cartilages. As you know about the bone and the cartilage, you have studied before at the school level. So these are the connective tissues. They both are connective tissue. They come in specialized connective tissue. Okay, so it basically forms the main supporting framework of the body and is primarily designed for a more effective production of movements by the attached muscles. So what is the main function? As you can see, it is helping in the movement of the body, the locomotion of the body with the help of the muscles. As you are moving your hand, you are walking, you are doing any physical movement, it requires your bones, your cartilages and muscles. So if we talk about the synonyms of bone, there are two terms. One is the os, that is a Latin word. L is representing Latin, and another is osteon, that is a Greek word. They both represent the bones as a synonym. So let's we know about some terms regarding bone, like what is osteology. As you have studied that osteon is used for bone, and basically osteology means the study of bones. Okay, then if we talk about ossification, what is ossification? Ossification is the hardening or calcification of the soft tissues, basically process of bone formation. Okay, what is this? It is a process of bone formation in which soft tissues are hardened or calcified. Then if we talk about osteomyelitis, osteomyelitis, as you know, when there is a term itis, it is used for inflammation. So basically it is the inflammation of the bone due to the bacterial infection. Okay, any bacteria or inoculum is affecting the bone, that is called osteomyelitis. Then we talk about osteomalacia. And what is osteomalacia? Osteoma and osteotomy. Okay, so osteomalacia is basically softening of the bones, weakening of the bones due to vitamin D deficiency. You know, vitamin D is very necessary for bone, so it is mainly responsible for this condition. Then if we talk about osteoma, so we have studied like oma is related to cancer. Osteoma is a abnormal growth of bone. Okay, so it is also of two type. One is the homoplastic osteoma and another is the heteroplastic osteoma. Okay, so what is mean by homoplastic? When the outgrowth is itself coming from a bone, when a bony outgrowth is coming from a bone itself, it is called homoplastic osteoma. And then if the outgrowth is coming from a soft tissue, then it is called heteroplastic osteoma. And then the last we talk about osteotomy. Tomy means cutting. It is basically a surgical procedure in which bone is cutted to reduce the length or altering any deficiency. So this is about all the medical terms regarding the bones. Then we'll go further. So if we talk about little bit theory part about the bone, then what is written here, that bone is 1/3 connective tissue of the body. Okay, first of all, bone is a 1/3 connective tissue. Then it is impregnated with calcium salts which constitute 2/3 part. Okay, like bone is the 1/3 part of the connective tissue, in which 2/3 part is the calcium salts. Okay, then the inorganic calcium salts that mainly constitute of calcium phosphate, calcium carbonate and traces of other salts make it hard and rigid. What these salts are functioning, these inorganic salts helps to make the bone hard and rigid so as to support the body weight. Okay, it helps in the resistance to compressive forces, as I have told. Then any impact force of jumping, like any tough movement we are doing. Then the organic part, as we have studied the inorganic part, that is constituting of salts, the organic parts have tissue that is mainly collagen fibers that makes it tough and resilient, basically flexible, okay, and which can afford resistance to tensile forces. In strength, bone is comparable to iron and steel. It is very tough, hard, and it is compared to iron and steel. Then we talk about other things, like bone is very much a living tissue. How? We'll study. Because it is highly vascular with a constant turnover of its calcium content, it shows a characteristic pattern of growth. It grows, okay, it heals, it fights the diseases, okay, after a fracture or any problem. Like it has greater regenerative power than any other tissue of the body, okay, except blood. This is important. Like bone have the greatest regenerative power except the blood. It can mold itself according to changes in stress and strain it bears. It shows disease, atrophy, and overuse, hypertrophy. Sorry, disuse. So, if we talk about atrophy and hypertrophy, what is this? Atrophy is the decrease in cell size. Okay, so bone decreases its size, or it can also increase by the overuse. Okay, so this is the term and this is the theory part. Then we'll go to further. So guys, this is a table given for the division of the skeletal system, how the system is divided. So there are classification like based on regions of the skeleton. So we divide into two parts. One is the axial skeleton and other is the appendicular. Axial part is the middle part of the complete skeleton system, that is mainly consisted of the head, chest part, abdomen, and the appendicular skeleton is mainly about the periphery. The axial is for central and appendicular is for periphery. Periphery regarding to limbs. Okay. So axial skeleton constitute of skull, that basically your head region, in which cranium is there. Cranium, the box of the brain we say. Then facial bones are there. Okay. One hyoid bone. We'll discuss regarding the according to diagram, like bones of the ears, then vertebral column, the spine part, it is also in the central region, the thorax, frontal region, okay, sternum, ribs, these are the part of axial skeleton. And then it comes the appendicular skeleton. Okay, so appendicular skeleton includes basically your periphery part. What it includes? Your pectoral girdles and pelvic girdles. Basically the girdles, pectoral girdles means shoulder region and pelvic is the hip region. Okay, like in clavicle, scapula, upper extremities like humerus, ulna, radius, carpals, metacarpals, phalanges. These all the bones are of the basically your upper limb, that hand region. Okay, after that we talk about the pelvic girdle or hip bone. There are then lower extremities are there, like femur, fibula, tibia, patella, tarsals, metatarsals, and phalanges. These are of the legs. Okay, this is for hand and this is for legs. So these are the peripheral bones or the appendicular skeleton. So next we'll go further. So let's a little bit get briefed about the functions of the bone. So if we talk, the bones give shape and support to the body and resist any forms of stress. We have studied this point, okay, it's common. These provide surface for the attachment of muscles. This is very important, tendons and ligaments. As you will go further in the anatomy subject, you will study the all the attachments of muscles, tendons, ligaments and the bone, basically when you will study. So this is a very important function, as bone give a surface, a platform for the muscles to attach and function. Okay, then these serve as a lever for muscular actions. You know, it is very important. The skull, vertebral column and thoracic cage protects. This is very important. It protects the vital organs of the body, that is a brain, spinal cord and thoracic viscera. Other than that, the bone marrow, very important concept. the living tissue that is present in the bone, it manufactures blood cells. Okay, it is a very important part. It manufactures blood cells, the RBC, the WBC, all the things. Okay. Other than that, bone stores 90%, 97% of the body calcium and phosphorus. It is a reservoir for calcium and phosphorus. Then bone marrow contains reticuloendothelial cells which are phagocytic in nature and take part in immune response of the body. A very important point. Okay. These are the cells which are phagocytic in nature and they directly take part in the immune response of the body. And the larger paranasal air sinuses affect the timbre of the voice. What is paranasal air sinuses? It affects the timbre of the voice. Basically, it helps in the voice formation. So this is about the function. So now we'll study the classification of bones. How bones are classified. There are different bases. Like first is the according to shape. We talk about long bones. First is the long bone. You know the basic structure of the bone, like it is kind of this. Okay. So what this paragraph is telling us, that each long bone has an elongated shaft. Okay. This we are talking about this region that is called diaphysis. That elongated shaft is called diaphysis. Okay. Other than that, then there are two expanded ends, this one and this one. Okay, so these both are called epiphyses. What they are called? Epiphyses. Okay, which are smooth and articular. Articular means they can attach to another part and articulate with them. Okay, then if we talk about the shaft typically has three surfaces. Okay, separated by three borders. Like we can discuss the surfaces of the bones. We'll further when we study the regional anatomy, then we will study the surfaces, the borders, everything. Okay. Then a central medullary cavity inside the bone shaft. Okay, and a nutrient foramen directed away from the growing end. Okay. So if we talk about the examples of the long bone, we have humerus. You know humerus? The shoulder joint where the shoulder joint is formed. Humerus is there of the upper hand. Then there is radius, the ulna, the femur, tibia and fibula. Like the bones of the hands and legs. These are long bones. Example of long bones. Okay. Then if we talk about miniature long bones, what it means? Like they are long bones, but still they have only one epiphyseal end. Okay, like only one, this end will be there, not this end. They will be embedded somewhere. So the examples are metatarsals, metacarpals and phalanges. As you can see the phalanges, you can, if you want to see the diagram, here we have, see, this is phalanges. And it has one epiphyseal end, but another one is not there. Okay, so let's go back and see where we are. Then we go to the short bones. Okay, another classification. Then in short bones we'll see that the shape is usually cuboid, cuneiform, trapezoid or scaphoid. It is mainly telling about us of the tarsals and carpal bones which we have in the hand. So if we see in the diagram, see here, this is the diagram of the hand. So can you see these bones of the carpals? Like here is the trapezoid. Okay, and if we see, there are scaphoid, okay, cuneiform, cuboid, all the bones are there in your carpal. This type of bones is called short bone. The same is in the tarsals when we see the legs. Okay, then let's come towards flat bones. So if we talk about the flat bones resembles shallow plates and form boundaries of certain body cavities. Okay, just focus here. Like we talk about examples, bones in the vault of the skull and ribs, sternum and scapula. What they are doing, they are forming a shallow plates and forming the boundaries of certain body cavities. Okay. Then if we talk about irregular bones, then there are examples vertebra, hip bone, bones in the base of the skull. Okay. Then the pneumatic bones. Pneumatic bones are irregular bones that contain large air spaces lined by epithelium. Okay, like we have studied in the wings of the birds, they have pneumatic bones. Examples maxilla. Maxilla have air spaces. Sphenoid, ethmoid. They make the skull light in weight and help in the resonance of the voice and act as a air conditioning chambers for the inspired air. Now you can see the sesamoid bones. The sesamoid bones are the bony nodules found embedded in the tendons or joint capsules. Okay, they have no periosteum and ossify after birth. They are related to an articular or non-articular bony cartilage surface, and the surface of contact are covered with hyaline cartilage and lubricated by a bursa or a synovial membrane. Like we talk about examples, patella, the bone at the knee, the pisiform, the fibula. Okay, these are the sesamoid bones. And what are the functions of the sesamoid bones? To resist pressure, like when we move or we do the squats, there is pressure on the knees. To minimize friction, as the synovial membrane is present and the bursa is there. Okay, it's a cavity lubricated. So to alter the direction of pull of the muscle and to maintain the local circulation where the arteries and the veins are passing from that particular region. So this is the sesamoid bone. So now we'll see the diagrams of these classifications. So you can see here, this is the long bones. Examples of the long bone, you can see the humerus here. Okay, this is the humerus, in which when there is a diaphysis, then epiphysis. Okay, medullary cavity is there, head pitch articular region is there. Okay, we'll discuss further. So this is the long bone. Then we talk about the small bones. I told you about the hand, the carpals, okay, and the tarsals that represent the this region. This is the small bones. Okay, then we'll go towards irregular bones. So this is the bones of the vertebra. You can see they are very irregular vertebral bones, that is in your spinal region. Okay, so this is the irregular bone. Then if we talk about, now you are seeing the pneumatic bone example, that is your ethmoid. You can see here the ethmoidal air cells where the air spaces are there in which they accommodate air. Okay, so this is the pneumatic bones. Then if we go towards next example, that is your sesamoid, you can see the patella bone. Okay, see, focus here. So this is the patella. It is a sesamoid bone and it's present at the knee. This is the space where it is present. Then the next classification is the accessory bones that are not always present. These may occur as ununited epiphyses developed from extra centers of ossification. Okay, examples are sutural bones, okay, or the vacillinium, tuberosity of the fifth metatarsal. In medical legal practice, the accessory bones may be mistaken for fractures. This is an important point you can count. However, these are often bilateral and have smooth surfaces without any callus. Okay, then we talk about the heterotopic bones. That bones sometimes develop in soft tissues. Okay, like horse riders develop bones in adductor muscles, riders bones, and if this is abnormal, it can also be called as heterotopic osteoma. Okay, the outgrowth in the soft tissues, as I've told earlier. So next classification is your developmental classification, like how bones is developing. So if we talk, there are, one is the membranous bone, then is the cartilaginous bone, okay, and then is the membranocartilaginous bones. So if we talk about membranous bones or dermal bones, it ossify in the membrane intramembranous or mesenchyma ossification is present and are thus derived from mesenchymal condensations. Examples: bones of the vault of skull and the facial bones. Okay, remember this part. Like the bones of the vault of the skull, that is the cranium, and facial bones are the membranous bones that are developed from membrane. Then we talk about cartilaginous bones that ossify in cartilage. Remember this. Okay, intracartilaginous or endochondral ossification. It is basically depending on how the ossification is taking place and are thus derived from the performed cartilaginous models. Examples: bones of limbs, vertebral column and thoracic cage. They all are cartilaginous bones. Then we talk about membranocartilaginous bones that ossify partly in the membrane and partly in cartilage. And its examples are clavicle, mandible, occipital, temporal and sphenoid bones. These are the examples of membranocartilaginous bones. Next we will discuss the somatic bones. Okay. So if we talk about the somatic bones, most of the bones are somatic. And the visceral bones, these develop from pharyngeal arches. Examples are the hyoid bones, part of mandible and ear ossicles. Okay. Regional classification we have studied in that table, your axial and the appendicular skeleton. Then if we talk about the structural classification of the bone, what this is telling us, like macroscopically the architecture of bone may be compact or cancellous. Okay, so compact bone is dense in texture like ivory but is extremely porous. It is best developed in the cortex of the long bones. This is an adaptation of bending and twisting forces, a combination of compression, tension and shear. Okay, what you understand here, that compact bone is dense in texture, high collagen tissue is there, high collagen fiber, and still they are very porous. Okay, in the cortex region they are very porous and it is an adaptation to bending and twisting forces. Then we'll go further. You can see here, like we are seeing compact bone. So this is the medullary cavity as we studied. This is the spongy region. Okay, spongy bone that is filled with marrow or the matrix. Okay, so next we'll see the cancellous bone. Okay, so cancellous bone or spongy bone, it is also known as spongy bone or trabecular bone, another name, remember it. The first one, what it was, compact bone. Okay, then second is the cancellous or spongy or trabecular. This is open in texture. Okay, and made up of a meshwork of trabeculi, rods and plates, between which are marrow containing spaces. The trabecular meshworks are of three primary types, namely meshwork of rods. Okay, next is the meshwork of rods and plates, and other is meshwork of plates. Like three are there. One is for only rod, second only for the plate, and third is the rods and plates, both are there. Okay, so cancellous bone is an adaptation to compressive forces. What we studied in compact bone, it is bending or twisting forces. It is an adaptation of bending or twisting forces. But in cancellous bone, there is the adaptation to compressive forces. Like bones are marvelously constructed to combine strength, elasticity and lightness in weight. Though the architecture of bone may be modified by mechanical forces, the form of the bone is primarily determined by heredity. Okay, so what this line is telling you, that structure may be modified by mechanical forces. As we studied that bone is a living tissue, it can modify according to the adaptation, but the form of the bone is primarily determined by the heredity, what you are getting by the your DNA, your genetics. Okay, according to Wolff's law, trajectory theory of Wolff, what it is saying, like the bone formation is directly proportional to stress and strain. So this is very important. As you want to grow your bones in the body, you have to do physical exercises, physical work is very important. Like without stress and strain, the bone formation, it does not be amplified. So there are two forces. One is the tensile force and another compressive force. Both the tensile and compressive forces can stimulate bone formation in proper condition. Okay. The architecture of cancellous bone is often interpreted in terms of the trajectorial theory. Thus, the arrangement of bony trabeculi, the lamellae. Okay, what we studied, the arrangement. I have told you there are three types. The arrangement of the rods, structures like plate-like structure, and both rods and plate. So, what they are telling that this arrangement is governed by the lines of maximal internal stress in the bone. Pressure lamellae are arranged parallel to the line of weight transmission, whereas tension lamellae are arranged at right angles to pressure lamellae. The compact arrangement of pressure lamellae forms bony butters and for additional support like calcar femoral. Okay. So what basically they are telling, this is a very important concept, just focus on it. Like this is a bone, so they are telling about the arrangement of the lamellas according to the force. So focus here, this is the compression lamellae. Okay, these are the compression lamellae that resist shearing stresses due to pull of muscles attached to greater trochanter, and this is the tension lamellae that forms lower part of the head, resist bending forces in the neck. Okay, this lamellae is resisting the bending forces and this is resisting the compressive forces. Okay, and that it forms the calcar femoral that resists shearing stresses between the neck and the shaft. Okay, so there are three basically stress we are talking about. Mainly two are there, compressive and tensile forces, and both forms a shearing stress. Okay, as we have studied in physics. So this is the diagrammatic representation of the compression and tension lamellae in a sagittal section of the upper right femur. Okay, so next we'll go further. The second, what we studied first was the macroscopically, then second we'll study the microscopically. The bone is of 5 types, namely lamellar, including both compact and cancellous, woven, fibrous, dentine and cement. Okay, it is basically mainly derived from the structure, microscopic structure. We are classifying lamellar, woven, fibrous, dentine and cement. Okay, so what is lamellar bone? It is most of the mature human bones, whether compact or cancellous, are composed of thin plates of bony tissue called lamellae. The bone in which lamellae is present, these are arranged in piles in a cancellous bone but in concentric cylinders. Haversian system, you have known Haversian canal, we'll study secondary osteon in a compact bone. Woven bone are seen in fetal bone, babies, fracture repair and in cancer of bone. Okay, if we talk about fibrous, found in young fetal bones but are common in reptiles and amphibia. Okay, then dentine and cement occur in teeth. We have studied that before. So let's compare the compact and the cancellous bone. There is a table. So there are comparison based on location, lamella, bone marrow and nature. So if we talk about the location, the compact bone is present in the shaft, that is your diaphysis. I told you, like this is the bone. So this is the diaphysis, the shaft region. Okay, so here the compact bone is present. Okay, and whereas the cancellous or the spongy bone is present in the epiphysis here. This is the cancellous or spongy bone and the epiphysis of the long bones. Then they talk about lamellae. They are arranged to form Haversian system. In compact bone, there are Haversian system, that is cylindrically concentrated piles of the lamella that forms a Haversian canal also, we'll discuss. And in cancellous bone, it is arranged in a meshwork. So Haversian systems are not present like this. Okay, as we studied that tensile compression, tensile forces, compressive forces, shearing stress. Okay, so in epiphysis there are meshwork like structure. If we talk about bone marrow, in compact bone, yellow bone marrow is there which stores fat after puberty. It is red before puberty. And if we talk about cancellous spongy bone, there is red bone marrow is present here. Okay, here is red and here is yellow. Okay, so red produces RBCs, granular series of WBC and platelets. Okay, so what is the function of yellow bone marrow? It stores fat, and red region is for producing formed elements, that is RBC, WBC and platelets. So the nature of compact bone is hard and ivory like, and cancellous bone is spongy. So this table is very important. I will make star mark. You should know about the compact and the cancellous bone and the comparison in a long bone. So if we study the gross structure of an adult bone, so naked eye examination of the longitudinal and transverse section of the long bone shows the following features. So now we will discuss briefly in detail about the long bone. Okay, so let's study the shaft region of the long bone, that from without inwards it is composed of periosteum, cortex and the medullary cavity. Okay, so first is the periosteum, then is the cortex, and then inside is the medullary cavity. Okay, so what is periosteum? Periosteum is a thick fibrous membrane, okay, covering the surface of the bone. It is a covering of the surface of the bone. It is called periosteum. It is made up of an outer fibrous layer and an inner cellular layer. So periosteum is mainly of two part. Okay, this is the outer fibrous layer and this is the inner cellular layer. Okay, which is osteogenic in nature. Periosteum is united to the underlying bone by sharp-edged fibers. Okay, and the union is particularly strong over the attachments of tendons and ligaments. At the articular margin, the periosteum is continuous with the capsule of the joint. This is important. And the abundant periosteal arteries nourish the outer part of the underlying cortex also. Periosteum has a rich nerve supply, which makes it is the most sensitive part of the bone. Very important part, that periosteum, okay, has the richest nerve supply and it is the most sensitive part of the bone. Then we talk about the cortex, the second layer inside. Cortex is made up of a compact bone which gives it the desired strength to withstand all possible mechanical strains. Okay, then we talk about medullary cavity. It is filled with the red or yellow bone marrow. That cavity, it contains bone marrow. At birth, the marrow is red everywhere with widespread active hemopoiesis. Okay, because at the time of birth we need blood formation at a rapid stage, so all the red marrow helps in the hemopoiesis. As the age advances, the red marrow at many places atrophies and is replaced by yellow fatty marrow with no power of hemopoiesis. Okay, so red marrow persists in the cancellous ends of the long bones, as we have studied the epiphyseal region. Okay, so this is the cancellous region where the red marrow is present, and the shaft region is the yellow marrow. If we like discuss here, we take the color. So this is the yellow region and this is the red region. Okay, see this part, this is the cancellous part. So by this diagram you can easily relate. In the sternum, ribs, iliac crest, vertebrae and skull bones, the red marrow is found throughout life. It is very important, like at the age old also, the sternum, the ribs, iliac crest, vertebrae and skull bones have the red marrow throughout the life where the hemopoiesis takes place. It is very important. Then we go further. Let's discuss about the two ends of a long bone that are made up of cancellous bone covered with hyaline articular cartilage. Okay, it is very important. Hyaline cartilage that is responsible for the articulation in the joints. In the next chapter we'll discuss about the joints. So hyaline cartilage is also called as articular cartilage because it helps in the articulation of the two different bones at the time of joints. Okay, so this is the cancellous bone, this is the fibrous capsule, okay, the periosteum, the outer layer, okay, the cortex, the compact bone part, and the medullary cavity inside where the marrow is present. Okay, see this structure carefully. So what we have here, one is the articular cartilage, the cancellous bone, the periosteum, okay, compact bone, and the medullary cavity. As you have discussed, at the time of birth, red marrow is present throughout. After that, this region becomes yellow marrow as age advances and become a fatty storage without doing any hemopoiesis. Okay. So next we'll discuss about the parts of a young bone. So a typical long bone ossifies in three parts. Remember this. The two ends form secondary centers and the intervening shaft form a primary center. Okay, so let's take an example. If this is a bone, a long bone, so this is the shaft region. What is this? It's a shaft region. So here the primary center is present where the ossification takes place, and here the secondary centers are there where the secondary ossification takes place. Okay, so just focus on this diagram. So this is the epiphysis, okay, the ends, epiphyseal plate of cartilage, the metaphysis, compact bones, cancellous bones, and the diaphysis, your shaft region. This is the shaft region. So next we'll basically little bit discuss about these things, epiphysis and all. The ends and tips of bone which ossify from secondary centers are called epiphysis. As I have told, at the ends secondary centers are present and these are called epiphysis. So what is the definition? The ends and tips of bone which ossify from secondary centers are called epiphysis. It has following parts: the pressure epiphysis, it is articular and takes part in transmission of the weight. Examples: head of the femur, lower end of radius, etc. Then the traction epiphysis is non-articular, which doesn't articulate with any bone and does not take part in the transmission of the weight. It always provides attachments to one or more tendons which exert a traction on the epiphysis, like bending or twisting. Okay. Then we have atavistic epiphysis. Is phylogenetically an independent bone which in man becomes fused to another bone. Fine. Then we'll go further. So then we have aberrant epiphysis. That is not always present. It is rare. Examples: epiphysis at the head of the first metacarpal and at the base of the other metacarpal bones. Okay. So there are different types of epiphysis you can study just for knowledge, like sternum, traction, pressure, atavistic, and one is the aberrant, which is not common as such. Then we'll go to epiphyseal plate of cartilage. What is functioning? It separates the epiphysis from metaphysis. Okay, remember the plate is there present between the epiphysis and the metaphysis. That is called epiphyseal plate of the cartilage. Proliferation of cells in this cartilaginous plate is responsible for the lengthwise growth of a long bone. What is happening? See carefully. So this is an epiphysis. This is the metaphysis. Here between is the plate. Okay. So the growth in this region, when proliferation takes place, it will increase the length of the long bone, both the sides. Okay. So after the epiphyseal fusion, the bone can no longer grow in length. The growth cartilage is nourished by both the epiphyseal and metaphyseal arteries. Okay. So when the complete fusion takes place, the proliferation takes place, the growing of the long bone stops. Okay. So next we'll study about the blood supply of bones. So in the long bone, the blood supply of a long bone is derived from the following sources. So first is the nutrient artery. What we are studying? Nutrient artery. It enters the shaft through the nutrient foramen. We have gone through this word. Let's see where this nutrient foramen is present. So here you can see the nutrient artery where the space is there as a foramen where artery embeds, runs obliquely through the cortex and divides into ascending and descending branches in the medullary cavity. Okay, see, this is the cortex region. You can see here. I will change the pen. So this is the cortex region and this is the nutrient artery. Okay, what it is doing, it is entering obliquely. Okay, what it is doing, it is entering obliquely in the cortex region and then dividing into different parts, that is ascending, it is going upside, and descending downside branches in the medullary cavity. Okay, so then we'll go further. What's there? Each branch divides into a number of small parallel channels. So basically we are talking about the blood supply of the bone. In the long bone we are seeing nutrient artery that is entering from the nutrient foramen obliquely into the cortex. Okay, so this is the like cortex and this is the medullary cavity. So this is how it is entering and dividing into ascending and descending branches. Then it is forming, it is forming number of small parallel channels which terminate in the adult metaphysis by anastomosing with the epiphyseal, metaphyseal and periosteal arteries. Like you can see here in the diagram, the anastomosis is present here. Okay, see, arteries in the metaphysis before epiphyseal fusion and the metaphyseal arteries are here, this region, and here the anastomosis takes place. See, this is the region where anastomosis between the epiphyseal and the metaphyseal arteries after fusion of epiphysis. Okay, this is the concept. Then we'll see a nutrient foramen is directed away from the growing end of the bone. Their directions are indicated by a jingle called "To the elbow I go, from the knee I flee." Okay, like from downwards it's descending towards the elbow. See, this is the example. Then we'll discuss about the epiphyseal arteries. These are derived from periarticular vascular arcades found on the non-articular bony surface. Out of the numerous vascular foramina in this region, only a few admit the arteries and the rest are venous exits. Okay, the number and size of these foramina may give an idea of the relative vascularity of the two ends of a long bone. This is not so important, but you can study. Then we'll see the metaphyseal arteries, what it is written. These are derived from the neighboring systemic vessels. Okay, pass directly into the metaphysis and reinforce the metaphyseal branches from the primary nutrient artery. So in miniature long bones, we have seen the infection begins in the middle of the shaft rather than at the metaphysis, because, see, this is very important clinical part. Like we have discussed the miniature long bones, the phalanges, the metatarsals, the metacarpals. What is saying, the infections begins in the middle of the shaft, not at the metaphysis. Why? Because the nutrient artery breaks up into a plexus immediately upon reaching the medullary cavity. When the nutrient artery enters in the medullary cavity, it breaks and forms a plexus. We have seen the ascending and the descending branches. In the adults, however, the chances of infection are minimized because the nutrient artery is mostly replaced by the periosteal vessels. Okay, so that artery is present in the young bone. Okay, after that it is replaced by the periosteal vessels. Then we talk about the other bones. Short bones are supplied by numerous periosteal vessels which enter their non-articular surface. In vertebra, the body is supplied by anterior and posterior vessels, and the vertebral arch by large vessels entering the basis of transverse process. Its marrow is drained by two large basivertebral veins. Okay, when we talk about rib, rib is supplied by the nutrient artery which enters it just beyond the tubercle and the post periosteal arteries, the nutrient artery and the periosteal artery. Where is the tubercle? We have seen the rib, the head, below the head part is the tubercle. Veins are numerous and large in the cancellous and red marrow containing bones. In the compact bone, the accompanying arteries in the Volkmann's canal. There are two canals, Haversian's and Volkmann's canal. We'll study further. Lymphatics have not been demonstrated within the bones, although some of them do accompany the periosteal blood vessels, which drain to the regional lymph nodes. So this is the blood supply of the long bone and the different bone, short bones and all. Then we'll talk about the nerve supply. So nerves accompany the blood vessels. Most of them are sympathetic and vasomotor in function. A few of them are sensory, which are distributed to the articular ends and periosteum of the long bones to the vertebra and to the large flat bone. Okay, so sensory nerve supply is there, that is distributed to the articular ends and the periosteum. Periosteum is very rich in nerve supply and the blood supply. So now let's talk about the development and ossification of bones. Like bones are first laid down as mesodermal connective tissue. Origin. Okay. Condensation, conversion of mesodermal models into bone is called intramembranous or mesenchymal ossification, and the bones are called membranous or dermal bones. We have studied this classification before. Okay. Then we'll talk mainly the ossification. So it is take place by centers of ossification, each one of which is point where laying down a lamellae. So without wasting time, we'll discuss. Like this is the cartilage, then the calcification of the cartilage takes place, and this is called a primary center of ossification near the shaft, and there are two other secondary centers are there at the epiphyseal end where the cancellous bones formation takes place, and in between there is a compact bone formation. So this is the basic growth of a long bone. Fine. Then we'll discuss. Now we'll discuss little bit about the cartilage. Like definition, cartilage is connective tissue, I have told, composed of cells, chondrocytes. The bone cells are called osteocytes, and the fibers, collagen or yellow elastic fibers, embedded in a firm gel-like matrix which is rich in a mucopolysaccharide. It is much more elastic than bone. Okay. So let's general features. Cartilage has no blood vessels, very important, or lymphatics, no blood supply or lymph supply. The nutrition of cells diffuses through the matrix. Fine. Cartilage has no nerve supply, therefore insensitive. Fine. Cartilage is surrounded by a fibrous membrane called perichondrium. Like we have fibrous layer of the bone, what is called periosteum. Similarly, here is the perichondrium. And the articular cartilage has no perichondrium, so that its regeneration after injury is inadequate. Fine. When cartilage calcifies, the chondrocytes die and the cartilage is replaced by bone-like tissue, the osteocytes. Okay. The comparison between the bones and the cartilage we'll see. So there are three types of cartilage basically. One is the hyaline, second the fibro, and third is the elastic cartilage. We'll differentiate in the location. The hyaline cartilage is present in the articular cartilages of long bones, sternum, ribs, nasal, and some laryngeal cartilages. We have seen the articular region at the head of the long bones. Okay, the sternum, ribs, etc. Fibrocartilage is present in the intervertebral disc of the pubic symphysis, temporomandibular joints, sternoclavicular joints. Okay, this is the location. We'll study these joints in the next chapter. Elastic cartilage mainly present in the pinna, ear pinna, external auditory meatus, eustachian tubes, epiglottis, vocal process of arytenoid cartilage. Fine. If we talk about the color, hyaline cartilage is bluish white in color, as we have seen in the diagram. Okay, fibrocartilage is glistening white. Difference is there. Hyaline is bluish white. Okay, and the elastic is yellowish because yellow fiber is more prominent here. If we talk about the appearance, hyaline cartilage is shiny and translucent. Okay, but the other two are opaque. We can't see throughout them. If we talk about fibers, hyaline cartilage have very thin, having same refractive index as matrix. So these are not seen. Why? Because the refractive index is same. We can't see the fibers. Okay. Then in fibrocartilage, numerous white fibers are there and the elastic yellow fibers are there. Fine. You can see here the hyaline elastic cartilage. You can see it is very uniform. We can't see the fiber like structures. It is bluish white in color. Okay. So this is the epiglottis. This is the thyroid or cricoid cartilage. So next we'll go to fibrous cartilage. Okay. So if we talk about the vertebral disc, you can see the fibrous cartilage. It is glistening white and it is present in between the vertebral discs. It is basically forming the intervertebral disc. Then in the transverse diameter, then we'll little bit discuss about the clinical anatomy. Let's discuss a defect in membranous ossification causes a rare syndrome called cleidocranial diastosis. Okay, what it is basically, it is characterized by three cardinal features: varying degrees of aplasia of the clavicles. What is cleidocranial diastosis? It is the defect in the membranous ossification. We have studied the dermal ossification. What it's saying, it has three features. First is the varying degree of aplasia of the clavicle. Second is the increase in the transverse diameter of cranium and the retardation in fontanelle ossification. Okay, it may be hereditary or environmental in origin. Next, in the defect in endochondral ossification, it is cartilaginous bones, causes a common type of dwarfism called achondroplasia, in which the limbs are short but the trunk is normal. It is transmitted as a Mendelian dominant character. It is genetic, and also what is happening, limbs are becoming short due to defect in the endochondral ossification, because we know the limbs are basically formed by the cartilaginous bones. So periosteum is particularly sensitive to tearing or tension. Drilling into the compact bone without anesthesia causes only mild pain or an aching sensation. Drilling into spongy bone is much more painful. Fractures, tumors and infections of the bone are very painful. Fine. Then if the blood supply of bone is so rich that it is very difficult to interrupt it sufficiently to kill the bone. Passing a metal pin into the medullary cavity hardly interferes with the blood supply of the bone. Then we talk about fractures. Fracture is a break in the continuity of a bone. It is very common. The fracture which is not connected with the skin wound is known as simple or closed fracture. There are type of fractures are also. For important, very important, you can focus here. Like the fractures which is not connected with the skin, that is called simple fracture or closed fracture. The fracture line may be oblique or horizontal. The fractures which communicates with the skin wound is known as compound or open fracture. Okay, a fracture requires reduction by which the alignment of the broken ends is restored. Fine. So you can see here the closed and oblique fracture where only bone is here, but if the skin is also present, like bone penetrates the skin region, it is called open or compound fracture. Okay, then we'll see further what we have. Healing of a fracture takes place in three stages. See, very important. Repair by granulation of the tissue, then union by the callus, and the consolidation by the mature bone. Okay, first granulation takes place, proliferation of the cellular, and then the callus formation takes place, which joins the broken part. Okay, and then the consolidation by mature bone. Axis or second cervical vertebra may get fractured if dens of axis gets separated from the body. It hits the vital centers in the medulla oblongata, causing instantaneous death. Even fracture of laminae may cause death. It is very important. Remember this. Okay, what is saying, the cervical vertebra may get fracture if dens of axis gets separated from the body. It hits the vital centers in the medulla. Very, like if we see the hanging till death occurs due to fracture of dens of axis vertebra. Okay, very common case in the post-mortem, the suicide cases, where hanging causes death due to the fracture of the axis. Then we talk about rickets. Rickets is a deficiency of vitamin D, calcification of cartilage fails, and ossification of the growth zone is disturbed. It is very common. Ricket affects the growing bones, and therefore the disease develops during the period of most rapid growth of skeleton, that is of 3 months to 3 years in the children's. Osteoid tissue is formed normally and the cartilage cells proliferate freely, but mineralization does not take place. This results in craniotapes, rachitic sorcery at the osteochondral junctions. Harrison sulcus at the diaphragmatic attachments, enlarged epiphyseal limb bones, and the spinal and pelvic deformities that causes the rickets. For proper development of bones, a child requires adequate amount of calcium, proteins, vitamin D. Deficiency of calcium and vitamin D in growing children leads to widening of ends of bones. With inadequate ossification, this condition is called as rickets. So you can see the rickets bone and the normal bone. There is inadequate widening of the ends of the bone, the epiphyseal end. Next is the scurvy, deficiency of vitamin C. Formation of collagenous fibers and matrix is impaired. Defective formation of the intercellular cementing substance and lack of collagen cause rupture of the capillaries and defective formation of new capillaries. Hematoma in the muscles and bones cause severe pain and tenderness. The normal architecture at the growing ends of the bones is lost. Okay, then many skeletal defects are caused by genetic factors or by a combination of genetic, hormonal, nutritional and pathological factors. The vertebral arc or lamina of the vertebral column may remain deficient. The spinal cord may be covered by skin, spina bifida. There may be a protrusion of the meninges surrounding the spinal cord placed in the vertebra. We will study these things after. It is little bit high level for you now. We will study in different regional anatomy. In deficiency of calcium, vitamin D occurs in adult life. It leads osteomalacia, softening of the bones. We have studied. The bones on X-rays examination do not reveal enough tuberculi. Okay. Then deficiency of calcium in bones in old age leads to osteoporosis. Okay. It is mostly seen in females, males also. Due to osteoporosis, there is forward bending of the vertebral column leading to kyphosis. You can see here in the diagram, this is the bending of the vertebral column due to osteoporosis. You can see in the old age people, they walk while like bending. Okay. And here is the bone marrow biopsy. Bone marrow can be taken either from manubrium sterni or iliac crest in various clinical conditions to study any problem. And then bone tumor is there. It can be benign or malignant, can occur in the bone. Okay, benign is static and malignant is distributing, like tumor like structure is cancerous. So this is the end of the skeleton. Okay, hope you like this video and do follow, subscribe the channel for further videos. I will be taking joints in the next lecture. So thank you students, thank you very much.